Hello, my name is Raul Vasquez. I'm a 22-year-old med student from Guadalajara, Mexico. I'm studying at the Universidad de Guadalajara. I'm a member of valedictorian MD since 2019. With their help, I managed to score a 257 on Step 1 and 271 on Step 2 CK. The USMLE Step 2 CK is the second part of the process to become a fully certified ESFMG doctor. Its aiming is totally different from what we saw in the USMLE Step 1, switching now from the understanding and knowledge of the basic sciences to the application of these principles into real clinical scenarios. Most of the med students feel that they like this exam more, and some say that it's even easier than Step 1, but don't be fooled by this. This exam demands a strong attention, a better clinical analysis, and higher problem-solving skills. Furthermore, there is some new content and question styles in this exam, and this will be the main focus on our video. Similar to Step 1, this exam is mainly divided in disciplines, being medicine and surgery the ones with higher percentages. Then it's subdivided in many systems that may combine two or more of the main disciplines. However, the biggest difference is that these contents in the Step 2 are meant to evaluate specific skills that a clinician should have. These are called physician tasks, and the most important ones are diagnostic and treating abilities. As medical attention around the world is constantly changing towards a more preventive rather than treating scope, the evaluation of these principles is getting more representation every year. Things like disease guidelines and cancer screening, vaccination, sexual education, or non-pharmacological interventions are the brand new, highly important topics that are showing in the exam. And about the question style, this is a whole different world from what we are used to. A classic question will be like, which of the following is the best next step in this case? This kind of questions represents about 50% of what you will see on the actual exam. The main rationale of these questions is for you to follow an algorithm, organizing medicine into steps. Another kind of question will be like, which of the following is the most likely diagnosis? This refers to identify which is the patient's diagnosis. And these kind of questions represents about 20% of what you will see in the exam. Other kinds of questions include like, which of the following is this patient risk factor, or which of the following is the most likely indication in this case? These questions usually refer to what's the treatment option that you will give to that patient. This is where a tricky thing comes into play. They will give you information like the patient's history, chief complaint, symptoms, physical exam, and laboratory findings, and with that information they will want you to find which is the best course of action. Now, there might be many answers that are okay, but there will only be one that will take everything into account and therefore will be the best. Finally, there are some new types of questions that are being implemented, and the most relevant are patient scenario formats. These are whole clinical histories where you will get the patient information, the chief complaint, the patient history, physical exam, any laboratory findings, and these formats are usually followed by serial questions about the same patient. Then we have sequential items. Apart from what I already told you about these kind of questions, sequential items are very common in Step 2 CK, usually using a common vignette to ask several questions. You will commonly be able to answer just one question at a time, and you will not be able to go back to the previous one once that you have clicked the button next question and the next item appears. The final and very new question style are article abstracts or abstract formats. In this style, you will get an article abstract and its results in a very summarized fashion. You will be asked to interpret the results of the study, and also they will ask you questions about the subject. This is where your time handling skills will shine. And at last, this exam is also way longer than step 1. So better build that stamina, because it can take up to 9 hours on average. The exam consists mainly of 8 blocks that have like 38 to 40 questions, giving you a total of 318 questions. You will have about 45 minutes for break time. However, bear in mind that you only have 60 minutes to complete each block, and you will get nothing more. However, if you are able to have time to spare during the blocks, that extra time will be added to your break times, so you can manage it as you like. You can, for example, take a 5 minutes break between the first and the second block, and a 10 minutes break between the second and the third block, depending on how much or how good are you handling your time. For a more detailed explanation, get in touch with valedictorian, because they can provide you with any information you need.